There we go. Awesome.
I'm not sure if we can hear. Maybe you, I see us muted. I think you guys are muted.
Okay, hopefully I'm not muted. Okay, awesome.
Now we're good.
Okay, so Cedarcrest, we're actually located in Belton, Texas, where we are a behavioral health care system. We are a 158 bed facility. We're a hospital. So on the hospital side, we focus on acute care and stabilization. So anyone that's going through a mental health crisis, we provide care. We provide care from the age of 5 all the way up. We're one of the few programs that will take children at age 5 on the hospital side. Also, we have the RTC program, and we'll talk about the different programs a little bit more later. But on the RTC side, the residential treatment side, we take children, adolescents from the age of 11 through 17. The average stay for someone of that age in the residential treatment facility is anywhere between 6 to 12 weeks, and it could be longer depending on the needs of that individual. On the acute side in the hospital, the average stay is around 8 days. And again, it just depends on the level of stabilization. We do have what we call a PICU unit. A PICU unit is a unit where someone is going through a psychotic break and is potentially a danger to themselves or to others and need extra care. So we do provide that. So we call ourselves we are a leading mental health and addiction treatment center located in Belton. We sit on 33, and as I said, we're a 158 bed facility. We're getting ready to break ground and add probably another 70 beds sometime this year, and break ground and add more beds next year. So as you can see, the need for mental health services is growing rapidly. It's just astounding, the level to which we are growing. We're growing very, very fast. And so one of the things that we pride ourselves on is enriching the lives of those that we serve. So that's what we do. So when we look at the Forbes study, it's a brand new study by Qualtrics that identifies the nature of the global mental health problem and the crisis within that is worldwide. And it provides data and sheds light on the issues that people are facing. It provides insight about the despair that we're facing across the world. And as we know, particularly with COVID, this study took place late last year, but it somehow, it just appears that the crisis is growing more and more as the different variants of COVID continues to emerge. And so it's good to know what's going on around the world. In relation to this study, 67% of people report higher levels of stress since the outbreak of COVID. That's huge worldwide. A lot of people think, when we look at mental health, that, it's just, America, the US is facing a crisis. No, we're facing a crisis worldwide, and there is a demand for mental health services. 57% of people say they have greater anxiety since the outbreak. 54% of people say they are more emotionally exhausted. And, that's for lots of different reasons, for unemployment, for, having to stay at home with people that we really didn't spend time with, although they were family. There's lots of different reasons for that. 53% say they feel sadness day to day. That is huge, in terms of that particular study. 50% feel they are more irritable, and 42% report their overall mental health has declined. And so it's good to know that information as we look at, mental health services and what we provide. So mental health first aid, I'm a certified mental health first aid trainer. And so when we look at mental health, first aid is a help offered to a person developing a mental health problem or experiencing a mental health crisis. So I'm going to do a little bit of training. It is an 8-hour training. We'll kind of give you some insight in terms of mental health and providing first aid. The first aid is given until appropriate treatment and support are received, or until the crisis resolves. So, we're not doctors. We know we're not doctors. I know some of you online are not doctors, but it's good to have information. Mental health problems are common. At one time, mental health was a stigma, to say I have a mental health problem. The reality is the majority of us at some point has experienced a mental health problem or mental health crisis. Stigma is associated with mental health problems. And one of the things I love with the movement now, particularly in the US, is that we're trying to remove that stigma and trying to encourage people to get help, to seek help, and to talk to others. We're trying to improve everyone's awareness in terms of mental health. Many people are not well informed. So, even in schools for example, there's a program called the Jason Foundation, where materials is given to educators to train their students and to inform their students. So we're trying to inform people from a very, very young age about mental health crisis and what that looks like. Professional help is not always on hand. That, everyone's trying to increase that. And people often do not know how to respond. We haven't been given the tools in terms of how to respond to someone that express that they have a mental health crisis or a problem or a concern. People with mental health problems often do not seek help, but we're trying to remove the stigma from that. So what is a mental disorder? A mental disorder or a mental illness is a diagnosed illness that affects a person's thinking, their emotional state, and their behavior. It disrupts the person's ability to work, to carry out daily activities, to engage in satisfying relationships. So it can be very, very little things, very minute things, that we can experience on a short-term basis or a long-term basis. There are crises that we all face, but some people do not have the tools to process and to get out of a crisis situation. And so this is why it's so important that we have that level of awareness. For me, as someone who is spiritual, I understand that we are spirit, soul, and body. One of the things that's important is, someone let's start with the spirit first. You know, everyone has a sense of being God conscious or something outside of ourselves. Our faith reassures us, it provides stability. You know, we feed on, you know, God's word or something else. We have hope and confidence. You know, we're sustained by looking, you know, to the Lord or to someone or to a belief system. We love communication, motivation, but everyone does not have that. When we're talking about, you know, our soul consciousness, our intellect, our emotions, our will, our consciousness and our imagination, there are things that affect people that they have, their soul is broken, they can't think, they can't imagine, you know, their will is broken. And so, you know, these are some of the things that we address when we take care of someone with a mental health crisis. When we look at the body, someone who is world conscious, appearance, what goes on in your spirit, what goes on in your soul, your mind, your intellect will always be reflected on the outside in some way if we are aware of looking at how to assess that. And so this is what we try to do. We try to give people the tools to assess what's going on around them or around or in the lives of the people that they interact with. So it's important to know that, you know, I may be able to cover some things well, but because you have insight, you can tell by my body or by my interactions or how I appear that there's something going on in my mind. So, you know, one of the things that's interesting is, I'm sorry, I've just got to move our faces over a little bit. There we go. And so, when we're looking at our emotions and our feelings, one of the things that we look at is activation, how we become excited, alert, excited, elated or happy. And we have a range of emotions that we all have to deal with. Sometimes we, you know, the pleasant things, we contend, we're content, serene, relaxed, calm, but deactivation of you know, emotional or mental balance can be someone that is bored, depressed or sad, or it can lead to something unpleasant where we're upset, we're stressed, we're nervous, we're tense. And, you know, how we process that information or who is around us or what our life experiences are will depend on where we stay the most. You know, someone that doesn't have the tools to process well or continues to go through something on a regular basis will stay in a section that is unpleasant, where they're, you know, continuously stressed, they're nervous, they're tense, they're always upset. You know, so we really have to understand these range of emotions and what leads people to a particular emotion. Where are they located and how do we get them out of a particular place? You know, what tools do we need? What experiences do they need to have? You know, who do they need to talk to? Do they need counseling on a long-term basis? Do they need to see a psychiatrist? You know, do they need medication? And so it's always very good to understand these levels of emotions that we all deal with. And so, you know, one of the things that's very interesting, US adults with a mental health disorder in any 1 year, this is interesting information. Types of mental disorders, anxiety disorder. So people with anxiety, sorry, I've got to move. I've got to keep moving our faces so I can see the slide. Okay. Okay, so in the US, people with anxiety disorder, the statistical information we looked at earlier was worldwide, but the US, 18.1% of individuals, almost 20% of individuals in the US have an anxiety disorder. That is huge. That's a large percentage. Major depressive disorder, 6.8%. Substance use disorder, 8.1%. Bipolar disorder, 2.8%. Eating disorder, 5 to 10%. Schizophrenia, less than 1%. Any mental disorder, 18.5%. So, you know, when we're talking about 1/5 of our population has a mental health disorder, it's critical now to start thinking about what services we provide and bringing awareness to our community. And not just awareness, but actually tolerance, patience, compassion, and even love. So the impact of mental illness, disability refers to the amount of disruption a health problem causes to a person's ability to work, to carry out daily activities, engages, satisfying relationships. And we mentioned that earlier. Mental illness can be more disabling than many chronic physical illnesses. For example, the disability from moderate depression is similar to the impact from relapsing in terms of multiple sclerosis, severe asthma, or chronic hepatitis B. That is amazing. You know, that those comparisons can be made, you know, with a physical disability, you know, or something that happens. Sometimes it can be repaired with a mental illness. It can take a long time to actually recover for some people. The disability from severe depression is comparable to the disability of quadriplegia. That's very, very interesting information. And this comes from the Mental Health Awareness Forum. Recovery from mental illness. Recovery is a process in which people are able to live, to work, to learn, and to participate fully in their community. One of the things that I love when we deal with this area of mental illness, someone doesn't have to stay mentally ill for their entire life. And I think it's important to say sometimes we just go through a crisis, but not to label someone as mentally ill for the entire life. For some, this is the ability to live a fulfilling and productive life despite a disability. For others, recovery implies a reduction or complete remission of symptoms. So the spectrum of mental health intervention. So there can be prevention, early intervention, or treatment. So there is a spectrum. If there's early intervention, we may not need treatment, or if there's no intervention, then treatment may be required. And so the spectrum is well, becoming unwell, and recovering. And so anyone can be on that spectrum. There's a lot of us that's been, in something preventative, for example, just because of a crisis or a sense of a loss or a sense of failure or a sense of grief. We can all experience different levels of on the spectrum. Mental health first aid, the action plan. Okay, so let's go through the action plan. So the action plan in the mental health first aid is known as ALGE. So when we're looking at mental health and mental health awareness, it's important to assess for risk of suicidal harm. And so for example, I talk a lot to high schoolers. It's important, that we teach them how to assess for risk, because that will come up in conversation or just someone's behavior in the classroom. That it's important. We've got to listen non-judgmentally. It's very critical to listen, but not to be judgmental. We've got to give reassurance and information. It's important to have information and to be able to give reassurance. We're going to encourage appropriate professional help. So we realize that we're not the professionals, we're just the ones that are aware, and we'll point people to professionals. We've got to encourage self-help and other support strategies. It's okay to build a team around you that's going to support you, that is going to help you. So depression and anxiety are the most common mental illnesses. And at some point, I think we've all been anxious about something. It's important to have some similar, it has some similar signs and symptoms, and frequently co-occurs. So depression and anxiety. So depression. Major depressive disorder lasts for at least 2 weeks and affects a person's emotions, their thinking, their behavior, and physical well-being. The ability to work and have satisfying relationships, the ability to carry out usual daily activities. So these are the signs of depression. So you should be able to tell when someone is going through signs of depression. Major depressive disorder, these are signs of depression, bipolar disorder, postpartum depression, and seasonal depression. Depression signs and symptoms. The physical symptoms of depression is fatigue. When you're constantly thinking, you get fatigued, you get tired, lack of energy, sleeping too much or too little, overeating or loss of appetite, constipation, weight loss or gain, headaches, irregular menstrual cycles for females, loss of sexual desire, and unexplained aches and pains. The behavioral is crying spells, withdrawal from others, neglect of responsibility, loss of interest in personal appearance, loss of motivation, slow movements, use of drugs and alcohol. So depression signs and symptoms, psychological sadness, anxiety, guilt, anger, mood swings, lack of emotional responsiveness, feelings of helplessness, hopelessness, irritability, frequently self-criticize, self-blame, pessimism, impaired memory and concentration, indecisiveness and confusion, tendency to believe others see one in a negative light, thoughts of death and suicide. So, when we look at the previous slide, at some point, we've all experienced some of those symptoms at some point, but it doesn't mean that we are depressed or we have a mental health problem. It only becomes a mental health problem when we're not able to function or have healthy relationships. Anxiety disorder differs from normal stresses and anxiety. The symptoms of an anxiety disorder are more severe and can cause impairment in daily life, so work and relationships. So, this is who we are and what we can experience. So I'm trying to move. There we go. All right, so when we look at anxiety, I thought it was really interesting to include this slide. Our mind is racing. No, but should, might, yes, no, bad. Our mind is all over the place. And this is really important to watch in ourselves, and even, in our young people, even those in college who, have a lot on their plate, doing a whole lot there. We have to be very supportive and make sure that we look out for the signs. Dizzy, disorientation, lightheaded, vision strange and blurry, difficulty in swallowing, heart racing, palpitations. I remember, going through a whole lot of that when I was doing my, degrees in education, and, being a mom, and, trying to get it right, and, on the job, and so as humans, we juggle a whole lot, and we have to make sure that we are balanced. That's why self-care is so important. Sweating or shivering, wanting to run, jelly-like legs, restlessness, nausea, lack of appetite, feeling breathless, breathing fast, and shallow possible sleep disturbances. And so, there's different stages in life that we will go through some of these feelings, but it's when there's a combination of of more than one, and we're not able to process and get out of this in what we determine to be a normal time of processing these kinds of feelings. And so that's why it's always important to have the right people around you that you can talk through your feelings. So warning signs of suicide. It's important to understand, that these symptoms can become very, very serious, and people can, start having suicidal thoughts, ideations, and so it's important to understand what are the warning signs. Threatening to hurt or kill oneself, seeking access to means of hurting themselves. Talking, writing, or posting on social media about death, dying, or suicide, feeling hopeless, feeling worthless or a lack of purpose, acting recklessly or engaging in risky activities. So, for example, one of the things that I do outside of work, I'm a pastor in Belton, and I always love, one of my main assignments is talking to people about purpose. I really do believe that everyone is born on purpose, with purpose. And sometimes, when people don't know what their purpose is, it's difficult, for them to feel important in life. So it's, all of these things are very important for us to be aware of. Feeling trapped, increase in alcohol or drug use, withdrawing from family, friends, or society, demonstrating rage and anger or seeking revenge, appearing agitated, having a dramatic change in mood. So questions to ask when you start seeing this kind of behavior in someone. Ask directly whether the person is suicidal. Sometimes we try and avoid those questions, but sometimes it's important just to be direct. People will talk to you. When they do feel suicidal, it's important to talk to them and give them an opportunity to talk, because most of the time people do want to talk. Are you having thoughts of suicide? This is what's recommended by the Mental Health Forum. Are you thinking about killing yourself? If yes, if yes to either of the above, then ask whether the person has a plan. Have you decided how you are going to kill yourself? Have you decided when you would do it? Have you collected the things you need to carry out your plan? It's important to be direct, be upfront, and to ask. My training comes from the Mental Health First Aid Forum, which is US based. And so I just really want to share that with you, because when I first was trained, I thought, oh, wow, I don't think I could ask someone those kind of questions, but it's based on research. It's very much encouraged. Just be direct, because people will tell you once they discover that you've noticed something's going on in their life. So a little bit about Cedarcrest then. Okay, so I got to keep moving us out the way. Okay, so Cedarcrest Hospital is an RTC program, is a 158-bed inpatient psychiatric facility. We are committed to being a leader in Texas for providing evidence-based quality behavioral healthcare for children, for teens, for adults, older adults, and their families in a safe, supportive environment. We are a closed facility, so we don't just let people come and go. We do protect the patients that are there. With that, we We are part of the Arcadia Healthcare system. Arcadia Healthcare is a national behavioral healthcare provider, which operates in the United States, the United Kingdom, and Puerto Rico. And it's been in existence since 2005. Cedarcrest has actually been in existence since 1988, so prior to being part of Arcadia. So we've been around for a very long time. The mission of the Arcadia Healthcare is to maintain our standing as a world-class organization that sets the standards for excellence in treatment of behavioral health and addiction concerns. So we get assessed all the time as a hospital through Arcadia, through the state of Texas, and nationally. So we have an unparalleled commitment to our patients, to our staff, our communities, our professionals, and whoever we collaborate with. We recognize at Cedarcrest that it takes a team, it takes a village. So once they come to us and we stabilize and we get different organizations involved in the aftercare program. The aftercare program is very, very important to maintain long-term stability and health. And so we work with the community. So what do we offer? We offer a variety of mental health and chemical dependency programs for each person who comes to us for help. We offer acute inpatient services to children, adolescents, and adults. We stabilize patients' immediate crisis. So that is our main focus on the hospital side. We provide patients and families with skills to prevent or minimize future events that would require readmission. And then residential treatment for adolescents. So there's a long term, then there's a short term. So what do we provide, who do we treat? When it comes to children, we look at, suicidal, homicidal thoughts or attempts. So we'll address those: anxiety disorder, adjustment disorder, major depression, hallucinations, sexual acting out, anger, severe ADHD, erratic severe mood swings, substance use and abuse, survivors of trauma, and other types of mental health disorders. With adolescents, it's very, very similar, but we will look at the adjustment disorders, again, major depression, and everything else is very similar. Self-injury or harm, mutilation, suicidal ideation and behaviors, homicidal thoughts and behaviors, other mental health disorders. Adults, again, very much the same. I think the other thing that's added here is wild mood swings, alcohol abuse. And so we take care of a range of needs in terms of mental health for the different age groups. So we are located on 33 acres in Belton. We have 5 cottages, so we have it as a community style living. And we try and make the experience as normal as possible, especially for those who are in residential treatment. So we will rent out a movie theater or a bowling alley, and we will take the adolescents out. We encourage family therapy for adults, because we realize that nothing just happens in isolation, but it is mandatory for children. So we do get the family involved and provide family therapy. So with our cottages, as I said, there are 5 cottages. Cottage number 1 is a adolescent girl unit. So we do provide services based on gender and protecting each gender. So there is an adolescent girls unit. Cottage number 2 is an adolescent boys unit. Cottage number 3 is our inpatient child and adolescent unit. Cottage number 4 is our inpatient adult treatment program. And then our PICU unit, where adults need more protection. And cottage number 5 is our adolescent girls unit. So you can see that there are more beds for RTC girls. Girls display more mental health issues in terms of crying out for attention or for treatment. If boys are suicidal, boys, they're carried out. So boys are much more intentional, where girls will cry out for help. So in the adolescent program, we do have an educational component, which is provided by the University of Texas, a charter school on campus. And so we're very, very fortunate to have the University of Texas provide education. So what does a typical stay look like? In a typical stay, the patient will meet with a psychiatrist, evaluation and treatment plan is developed. And prior to them coming to us, we can actually do the assessments via Zoom, and then finish off the assessment when they come to us. So, you know, we just get the clinicians to fax the clinicals to us, and then we'll start doing the assessment. So we meet with the treatment team each day. Our average acute length of stay, as I said, was 8 days. Each day, patients engage in therapeutic, psychoeducation, recreational, and process groups, and meet with their therapists once or twice. Adults are offered recreational therapy once a day, while the adolescent practice twice a day. Family sessions are required for the adolescents, and it is encouraged in adults. The impact of our outpatient programs. Our outpatient programs offer intensive levels of care for people who are experiencing mental health or severe addiction challenges, but who do not need the round-the-clock care of residential or inpatient programs. So we do have an outpatient program for those that do not need residential care or do not want residential care. And it's and that's awesome. With that, so we have the intensive outpatient, and we have the partial hospitalization program, which both can be done in person or via Zoom. Admissions, our admissions department is open 24 hours a day, 7 days a week. And so, for example, I'm the community liaison. My phone number will be on this presentation. Someone can call me anytime, any day of the week, any time of the day. If they can't get through to the hospital or just have questions, or if there's any way I can help, we're here to serve. So while we do not allow NSS walk-ins, our suggestions to referral sources is always contact the admissions department first. This allows for our team to gather the patient's information, check bed availability, and run insurance. And that's important because we do take TRICARE East, TRICARE West, and this may not mean anything to some, but for others, it's important. We take most insurances, we take Medicare, Medicaid, and we take private pay. So the discharge planning, our discharge planning process begins immediately after the patient is admitted. So right from the onset, we start planning about aftercare, what is going to happen with this individual when they leave. So we have relationships with so many organizations. So if we have a patient on the acute side, the hospital side, and we know they need long-term care, or they need it to go to a detox facility, then we refer on, and then the insurance will pick it up. So we work with lots of organizations. So we work with various resources in the area to connect the individuals to follow-up care. This will be based on the patient's needs, insurance coverage, and ability to engage in services. Our therapists provide discharge planning on our RTC units and our adult acute units, while our children and adolescent units have a dedicated discharge planner. Okay, so what are some of the benefits of inpatient hospitalization at Cedarcrest? Mental health treatment consisting of learning new coping skills, that's a benefit. And some people just absolutely just need that. Just, just to withdraw and to learn some new skills on how to cope. What are some of the benefits on the residential treatment side of Cedarcrest? Evaluated by a multidisciplinary team to determine the best plan of care and to create an individualized plan of care. And then what are some of the benefits of the impact programs? That's the outpatient programs. Receive regular care from mental health and medical professionals. So thank you. I just wanted to just open it up and just see if you had any questions. Please feel free to ask questions if you have any. You put it in the chat. I hope this was a useful presentation.
Yes, Dr. Scott, Morgan Scott, it was very useful. And I had a question about with you traveling.
Oh, I'm sorry. I couldn't hear you talk.
Okay, can you hear me now?
I can. Sorry, my my computer volume was off. I turned it off and open your office. I'm sorry.
That's okay. So yes, it was a very useful presentation. I thought some of the stats you shared were very, especially the one about multiple sclerosis, the effects that you feel when somebody is depressed is the same. That was an eye-opener to me. I didn't realize. And the statement you made about a quadriplegic and how they would feel, and somebody with moderate depression. My question to you, from all your travels to various countries, is there something unique? What are the differences you see between a country like the United States and third world countries or developing countries with regards to mental health?
What is so interesting, as I travel, I've really learned to appreciate people and culture and people groups, because people are people all over the world. And our sense of need, sometimes is relative as well as it can be absolute. But our sense of need, the basics in terms of, Maslow's hierarchy of needs, our food, just warmth, shelter, those are basic needs. And so there is, a mental health crisis or mental health problem across the world that I think to some extent we've ignored in developing countries. I think COVID has actually made us face these issues, because people have, kind of been isolated and locked away and, being by themselves. So the needs are very similar. One interesting thing that came up recently is in terms of how does the government perceive need and take care of the need. And so, for example, in terms of mental health resources, Texas is 50th on the list, and Alabama is 50, is below that, and it's shocking. I think it's 49th, Alabama is 50. In terms of how do we perceive the importance of taking care of someone's mental health? Because if we're not stable mentally, it's very difficult to operate in all the other areas of our life. And someone that is dysfunctional becomes either a drain financially on our community. It can lead to criminal activity. They become less productive. And we need productive citizens to build the economy. So it affects us on multiple levels when we don't take care of the mental health of individuals. And mental illness can just develop through burnout. There are some people that's working incredibly hard, and just have a break. So it's important to be aware. You're mute.
I grew up in India, and we had a lot of stress over our exams and testing, especially at the end of the school year. And I remember one of my classmates committed suicide, and she was only 13 years old, and I was 13 and she was 13. And I wanted to know, that's one culture, and it was about 30 years ago or 25 years ago. Right now, I hear and see a lot about social media pressures. And I wanted you to, talk about something that our young people might face with social media.
I'm sorry, we had to move. The computer wouldn't charge. Okay.
Do you want me to repeat my question, Doctor?
Oh, there we go. Okay, thank you. I can hear you now.
Okay, you want me to repeat or did you hear me?
I heard your friend committed suicide after...
A classmate of mine, we were both 13 years old, and it was this, pressures growing up in a country during exams and testing and making good grades, etc. And then now in today's world, right now, I hear about, the same age group of 13, 14, 15 young teenage girls and boys, and the pressures from social media.
Yeah.
And I wanted you to talk a little bit about that, the pressures that come from something like social media, of all things.
Right. It's a very, very difficult time. I look at my children, they're early 30s now, and I think, oh my goodness, the things that young people face now, it's very different from when I was, growing up. And, social media gives you an unrealistic perspective of life. And so it creates it really does create a mind molder in terms of how one is supposed to live, but a lot of times it's not achievable. And so the pressures of being competitive, the pressures of conforming, the pressures of identity, the pressures of worth and value that comes from social media, it's very, very difficult. And that's why for me, I'm a very spiritual person. I think, we need something to anchor our self-image on, our importance as individuals. We can't think ourselves as being important based on how someone else perceives us, or whether they like us, whether they accept us, because, with social media, you can be outed if you don't, have the right ideologies, the right clothes, meet the expectations of others. So there is a lot of pressure, for young people now than than what I experienced, for sure. And social media can be very, very dangerous if it's not managed well. It's useful because, we're, using technology as a medium to communicate. It's incredibly useful, but unmanaged well, like anything else, can be very, very dangerous.
Thank you.
You're so welcome. Any other questions? Just want to say thank you again to the Round Rock Library. Thank you to Shunta. Shuti, okay, for just awesome organization. This was really excellent. Thank you so much for the invitation, and thank you to the library. This is an amazing library. I'm very impressed. So thank you.
Thank you.
Thank you guys for coming today. I hope the lectures were very informative. I know I learned a lot about both mental health, because I know right now with our generation, my friends, a lot of our parents don't like talking about mental health, but my friends, we know that it's important to talk about it, and we check up on each other. And this presentation was very informative. I learned a lot about mental health and what I should and should not do, and how I should and should not approach a person. So yeah, I hope you guys had a fun time listening to lectures and learned a lot. And thank you guys for coming and supporting the Round Rock Public Library. And I'll see you guys later. Thank you.